Hello, I'm Tracy Garbarino, and I'm one of the health literacy trainers for the North East and North Cumbria. This video is about how to use simple words. So what do we mean by simple words? Well, these are words that are 3 beats or less. So if you think about the term blood pressure, blood is 1 beat and pressure is 2. Also think about everyday words that you would use when you're talking to a friend, so no jargon or medical terminology. So why do we use simple words? Well, the words affect the readability, and this means how easy a piece of writing is to read. So simple words mean a lower readability, and we measure readability with the Flesch-Kincaid reading grade. And we're aiming for this to be at a level 6 or below, which is the same as a reading age of 9 to 11 years old or under. Simple words are also easier to understand because, as I said, not everyone understands medical jargon. Here are just a few tips for using simple words. So spotting the words that might be hard and think of how you would explain it to your friend. Think about a friend who doesn't work in healthcare or doesn't have any medical background or experience. And sometimes it might be a phrase that you use rather than just one word. If you do have to use jargon, put the simple word first and then the medical word in brackets afterwards. And the same for acronyms. If you do need to use an acronym, put the simple words first and then the acronym in brackets after. Here are just a few examples of what simple words look like. So instead of saying nausea, use feeling sick. Instead of requires, say needs. Instead of hypertension, say high blood pressure and then put hypertension in the brackets afterwards. And instead of using PPE, say personal protective equipment and then the PPE in brackets after. So here's an example of how to spot and change any hard words. As you can see, this sentence has a Flesch-Kincaid reading grade of 16.8, which is really high. So the sentence reads, to help to minimize the risk of developing a wound infection following surgery, you will be given intravenous antibiotics for 24 hours after the surgery. So have a go at spotting the hard words. Those tricky words are now in bold. So these are minimize, following, and intravenous. And then we had a go at swapping them to make the sentence simpler. This now reads, to help to lower your risk of developing a wound infection after surgery, you will be given antibiotics through a vein for 24 hours. As you can see, changing those words has made the Flesch-Kincaid reading grade down now to 12.9. So it's still a bit high, but it is a lot better. And so are there any tools to help? Well, there are a few. Firstly, the Hemingway app. You simply copy and paste your text into the app and it will highlight any long or hard words and often offers a simpler way of saying it. There's also the A to Z of NHS health writing. This offers a simpler way of saying medical terms. You can also use the CDC Plain Language Thesaurus. It's very similar to the A to Z of writing, offering simpler words to say medical terminology. However, do be careful, this is an American version. This video is part of a series which includes other tips and guidance for making your health information easy for everyone to understand. If you have any questions, please contact us at our email address stsft.nenchealthliteracy@nhs.net. You'll also find further information about health literacy, including training sessions available on the North East and North Cumbria Integrated Care website. Thank you for listening.